Hello, everybody, and welcome back, of course. Now, for those that forgot who I am, which I doubt it, but it's okay. If you don't know who I am, my name is Alexander Grachuin. My license is under the Maryland Board of Physicians. I'm a pulmonary care practitioner, of course, and today we're going to be doing some pulmonary rehab. Now, before we begin, of course, you can write in the comment section anytime you want if you want me to answer anything, or if you have a question that you want me to answer, or you have anything that you want to just display, go right ahead and I get to see that, and that's fine with me. So what I'm going to do right now is, hey Dana. Anyways, of course I'm working remotely, but I have to go over. So that there's this problem I'm having, and the problem that I have is I am not able to see you. Okay, and the only reason why I should be able to see you, why I want to be able to see you, is because as peer review, if you're doing something not correctly, like let's say you're doing something incorrectly and you feel like you're doing it right, you might be for the longest time doing it incorrectly, and you're perfecting your incorrect technique. So I need to see results. You know, you want to see results. You want to make sure that you're doing things right, doing things accordingly. Hi, Tammy. Hi, Peter. Hi, Robert. So if you guys can do me a big favor, and please write this down here. Please write this down. I'm going to show you how to get into my class. I'm going to leave a certain time open for you to join in with me with Zoom. Okay? Don't let technology frustrate you. It's okay. Now I have a bunch of screens right here, so I'm trying to look at all these screens at the same time, and I'm not, I guess you would say, 100% technology savvy, but I mean I can work it, a little bit. I'm closer to my 50s, but we do have to use technology when we do things remotely, of course. That can be through a telephone, which I can't do a lot with that. But video? Oh, yeah, I can see you. Of course I can. Hey, Larry. Hi, Debbie. So, with that being said, let me show you how to get into class. Now, the time that I'm talking about is on Tuesdays and Thursdays after this live. So, after this live, I want you to go to our website, go into my Zoom room, and I'll show you how to do it. Go into my Zoom room, and I get to see you, and I want to see what your performance is, answer any types of questions you may have, talk about your disease, talk about your complications, things like that. And I just want to make sure you're doing things correctly, because I'm not 100% sure if you are or not. I'm assuming you are, because I'm seeing a lot of people doing very well. I see some people came off auction already. I've seen some people that wanted more information and trying to get into the program itself. That's fantastic, but peer review is incredibly important, especially when it comes to performance. Because if you're doing something incorrectly, you might be professionally doing it incorrectly for a very long period of time, not realizing that, hey, you should be sitting up straight, or hey, there's one side of your chest is moving, the other side is not. What I mean by that is, if I see somebody in view and I see this, I see one side rise, but the other side does not, then I'm thinking consolidation on that left side, And there are therapies, a lot of different therapies that we can do to kind of fix that problem, okay? All right. That being said, let me show you how to do it, okay? So the times that are going to be available, and it's 1 hour with me, 1 hour with me. Don't worry about anything else. I'm not charging you anything to see me, okay? This has nothing to do with that. I just want to see your performance. I just want to see what you're doing, how you're doing it, how many times you're doing it, what type of disease you have, what type of complications you have. Do you have a lot of congestion? Because if you do, then I'm going to help you out with that. If you have a lot of chest tightness, I'm going to help you out with that. If you have pulmonary fibrosis, I'm going to help you with that. In fact, I specialize in that. My only concern is I have HEDS and push past normal joint mobility. I understand, Laura. We all stay, everybody has complications, especially if they have some type of problem like heart disease, lung disease, liver disease, bad hips, bad knees. But we all stay within our own limitations. So we stay within our abilities. And then I slowly increase the abilities so we can perform better, so we can be more independent, things like that. Does that make sense? Hi, Alex. I'm stage 4 COPD. I can't hardly shower or walk in the restroom. I am a good candidate for your class. Yes, Tammy. Absolutely. And no worries. Now, Tammy, I just want to let you know, your stage 4, I usually always get stage 4 people. And I don't want somebody who's just a little out of shape. I want somebody who actually has some real problems. So with your stage 4, I can bump that back up. Instead of being diagnosed and stay diagnosed with stage 4, I can probably bump it up to around maybe a 2, stage 2, maybe a stage 1. I can't, by legality, I cannot, how would you say, I can't legally say I can cure you, because I can't. I cannot do that. But what I can say is that 100% of all of our patients all had an increase in the lung functions. There is a high chance, and I would say high as far as, there's like a 30% chance, because 30% of the people that come to me, have got re-diagnosed from end stage back to normal. But that's only 30% of the cases. But needless to say, they don't have stage 4 anymore. Okay, now they're back to stage 1. Some of them are back up to above 80% FEV1/FEC, which is the forced vital capacity. And that's what we look at on a pulmonary function test to determine how severe somebody's lung stage is. So, you guys are awesome. Thank you for that. That's so nice. I'm looking at all those messages. You guys rock. Well, I won't let you down. Just all I ask for is give me a little bit of trust, and I'll earn your trust as we go along. If everything that we're doing and you're not improving, we're obviously doing something wrong, or we don't know what the heck we're doing. But in here, oh yes, HRN, it's the highest level you could ever reach. And what I mean by that is every single North American pulmonary rehab program and center in North America, okay, all 50 states, all of them based off of a compliance and as satisfaction as well as outcomes, they're only around 8% successful. The program that you're entering into is actually a 99%. We can't make up those numbers, by the way. Those are actual numbers. So 99% successful. So if there's a shot of improving you, we're the best shot there is to date. Having lung exacerbations right now. Just started 60 milligrams prednisone. If you're on 60 milligrams prednisone, which is great, it is a high dosage, and of course I'm assuming you're Mustang, Annie Mustang, and I hope I'm saying your name correctly. With the problem with bone degenerative loss with prednisone, as it tends to eat some of the calcium, you can combat that by drinking milk, or maybe lactate if you're lactose intolerant like me, or having calcium, just boost up your calcium, okay? And that will cause your bone degenerative loss not to be there, not completely obsolete, but if you're on prednisone, and you're afraid of bone it's like I'm having a hard time saying it, bone degenerative loss. So when your bones are becoming brittle, or brittle bone syndrome, you can combat that so you don't have it as bad by consuming more calcium. That's something that a lot of doctors say, but a lot of them don't either. See, you have lung exacerbation. Okay. All right, and you're on so you're on the Z-Pack. Okay, zithromycin, this AM onward. All right, just hang in there, okay? Exacerbations are not fun to go through, and of course you know that. but just in case anybody else does not know that, Anyways, let me show you how to get into the Zoom, okay? Now, Zoom is just something we use. We're not a Zoom program, but we use Zoom, the platform Zoom, so we can see you and hear you, so I can see you and hear you. Oh, Jeanette, we're working on that. I have no idea how that works. There's supposed to be something with stars that you can give stars to help support us and support the patients that it's really for the patients that can't see. There's some patients that live homeless. There are some and I don't reject anybody. I don't, it's just not who I am. So there are people that are homeless, people that can't afford anything. And there's so the stars is a way to help support them. And those stars, it's like a cent, 1 penny per star, I think, but anything helps, anything that will help, because some of these people, they absolutely need that help, and we do everything we can, we absolutely do everything that we can for everybody, but yeah, we're going to be fixing that, Jeanette, no worries. I try to stay awesome, Dana. I try to stay awesome. I'm so awesome. You should see my motorcycle. You know that? Yeah. I have a nice Harley Davidson Fat Boy. Limited edition. I love that thing, man. Woo. I had that thing for a bit now, but I've been customizing it, It's just something, my hobby. It's just a hobby that I do. Anyways. All right, let me show you how to get into the Zoom. All right, so I'm going to share my screen, okay? So the screen is going to change, so you're not going to see me. So here we go. Okay, so this is the Home Rehab Network. Home Rehab Network. So what I'm going to do here is I'm going to scroll. See, I can scroll down. And I can scroll down. If I keep scrolling down on the front page, it's homerehabnetwork.com, by the way. If I scroll down, keep scrolling down. Oh, right there where it says request information. That right there where it says request information. If I go there and type in my information right there, which is just so I know who you are and stuff, press submit, it'll go straight to us and it will come straight to me. And of course, I'll give you a call if you want me to. But anyways, to get inside the Zoom program, enter appointment. Now, it depends on your device. It should be on the top right. But if you click on enter appointment, okay, scroll down. Once you click on that, for anybody using a computer, you wouldn't see the menu button. It'll just be on tabs, and it'll be like on the right side where it says enter appointment. Like right here, it says enter appointment, right? So I'm going to scroll down once I click on that. And as I scroll down, there I am. I'm right there. All you would have to do to get in my Zoom, you just click on enter appointment. And if you don't have Zoom downloaded, it'll download it for you. But you just basically, I will be able to see you. Does that make sense? Okay. So let's go back here. So right here where it says enter appointment. Okay. Or I can click on the menu to enter appointment. Either way will still take me to the same place. So I'm right here. Here's that enter appointment button. I click on that, takes me to this screen, scroll down where you see me. Underneath my picture where it says enter appointment, click on that and it'll open up Zoom and you're going to be in the meeting with me. Okay? So remember how that works. You go to our website, homerehabnetwork.com. I am not going to get you to join. What I just want to do is find out what is going on, what do we have to do, and basically answer any types of questions or anything. It's no worries at all. The only problem with prednisone, I do drink a lot of milk, but of course, it's a lot of mucus. Yeah, it's going to be a lot of mucus, especially with, you're jealous. Oh, Jeanette, you ride motorcycles? You do? Yes, Glenda, if you Zoom for your doctor's appointments, it's the same thing. It's the same exact thing. You're seeing me as a clinician, And of course, I just want to find out what's going on. Okay. And anyways, that's all I want to point out. You always wanted a motorcycle? Well, Jeanette, if you, how about this? Well, I shouldn't say that because I was going to say, Jeanette, why don't you jump on the motorcycle with me and we'll just ride around the. I live at Ocean City. That's where my house is. So I live in Ocean City, Maryland, and I can easily just drive you on the main street next to the water. And if you ever want to do something like that, I'm all for it. You're 80. 80's still young. It's not the age, Jeanette. It's the mileage. It's always the mileage. All right. Well, let's go ahead and get into works. So the main reason, of course, is to get into the Zoom after this class. Okay, so the times for this live on Facebook and the other platforms like YouTube and things like that, those are from, of course, 1 p.m. till 2 p.m. After 2 p.m., I'm going to open up my Zoom, and I'm going to keep it open for you to join me after this live. Okay? So after this live, go to our website, homerehabnetwork.com, and no worries if your internet doesn't work very well. We'll make do with what we can do. Okay, no worries about that. Just hang in there. We have to deal with the technology, of course, but you don't have to be very computer savvy to do this. I promise you. We don't really have many people that are under the age of 50. We have a lot of people that are 60, 70, 80 years old, and they work the Zoom just fine. Okay, so don't let that stop you. If there's a chance of improving you, I'm the best shot there is to date. Everybody knows that. That knows me knows that. A lot of doctors know that. That's what they're like. Go with that drill sergeant guy. I'm apparently the drill sergeant person. Anyways, let's go ahead and get into works. So please grab your pulse oximeter. Okay, grab your pulse oximeter. Place it on your finger, turn it on, and just make sure your oxygen and your heart rate are within normal range. If your heart rate's a little bit elevated, like tachycardic, meaning it's above 100 beats per minute, it just means you might have a little bit of CO2 buildup or CO2 retention, and that's pretty common. Oxygen should stay above 88, okay? But there are some people in pulmonary rehab that their doctors said that they want them to be on average around 85%. That's true. That means that's that person's normal. That means somebody else should have the oxygen saturations at 95 or 92 or 99 or 98, but some people they want the oxygen saturations to be around 85. Okay, 99. Jeanette, 99% is a little scary for me. And the only reason why I say that, let me put it out like this. Think of it like this. Okay, you're measuring with a pulse oximeter. I'm assuming you're wearing oxygen. Is that correct, Jeanette? You don't have to tell me if you don't want to tell me. Are you wearing oxygen? How many liters of oxygen are you wearing if you are? Because okay, yeah, 93. Also need to look at the heart rate too, Debbie. Okay, so the one thing that I look at when it comes to pulse oximetry, and this is pretty basic, is that when you measure on your finger, at your part of your body, air comes into your lungs, right? Then, of course, the oxygen gets deposited into your blood, circulates to your heart. Heart consumes some oxygen at that point. You're on 2 liters, Jeanette? Okay. All right. So most likely I can take you off oxygen if that's what you want. And I can, even if you've been on oxygen for like 6-7 years. I mean, I don't just say, all right, take the oxygen off, I don't do that. What I do is I want to verify if you can be weaned off, and how I do that is I have to look at your lung functions, I have to look at your lung volumes. It's not a special medication, but we do wean people off oxygen all the time. Okay. When people come into this program, you'll see a lot of people coming into this program where they couldn't walk more than 5 feet, 10 feet, 15 feet, and now they're doing about 2 to 3 miles without stopping. They couldn't climb up stairs, and now doing 3 flights of stairs. A lot of people are on oxygen, not on oxygen. They'll talk about all the time in these classes. They'll say I was on oxygen for for 4 years or 6 months or just after the hospital. I've been on oxygen for 3 years, and I want to come off of it. So what I do is I increase the lung volumes to be able for the lungs to open up a little bit more to get more oxygen to come in, and that usually satisfies the problem. The problem is when I see somebody at 99% to 100%, these pulse oxes, sometimes if you can kind of see it without it turned on, I don't know if you can kind of see, there's 2 digits down here, 3-digit displays up here. That means the one on the top is going to be heart rate. Down here is going to be the oxygen. What happens if it shows 99%, but what would it mean if you're actually 200%? We see that. What does that mean? Do you understand what I'm talking about? So because the pulse oximeter can't display anything higher than 2 digits on this pulse oximeter, it could very well be higher than 99%. It could be very much, and we see it all the time in the hospital. We see some people at 205%, meaning they're oversaturating. Even on low oxygen, like 2 liters, 1 liter, 5 liters, which is a higher flow, of course. If you have, let's say you have a red blood cell, let's see if I can actually, well, let me see if I can show you. Let me see if I can show you here. Oh, actually, no, I probably wouldn't be able to. I wanted to see if I can show you. Anyways, let's say you have a red blood cell and there's 6 hemoglobins. Hemoglobins are proteins that bind onto gases to transport the gases, like oxygen, to the necessary organs for them to consume. Okay? And let's say it's 100% saturated, which a lot of people will say, I want that 100% saturated. No, you don't. You do not want that. If you're 100% saturated, meaning every single hemoglobin on that red blood cell has oxygen molecules on there, and then you have CO2, where's the space to carry the carbon dioxide? Because you're 100% saturated. There's no space to carry it. So the CO2 gets retained and doesn't get transported to the lungs so you can breathe it out because you're oversaturated with your oxygen. Does that make sense, everybody? I can go over more in that, especially when you're in class. But anyways. There is a small window, as for those that do not know, Medicare turned pulmonary rehab back on. That means all the other insurances are going to follow on the same thing, but it's only going to stop at the end of January. So you have a short period, you have a short window to try to get in this program without having to pay anything. But if you don't have insurance, you can use the Monu Lungs and still coming to see me 3 times a week. And I believe it's like $39 a month to see me. I think it comes up to like $1.30 a day to have somebody like me work with you constantly. So it's very inexpensive. This program is, But anyways, we have a short window, so if you're trying to get in, we would recommend coming in as soon as you can. Okay, and remember, you're doing all this from home. Okay, so pulse oxes, 99% might seem a little bit too high for me, but we'll investigate later. Anyways, that being said, let's go ahead and grab our incentive spirometer. So that's this device right here. We're going to sit up straight, make sure your back is nice and straight, okay? I'm going to take a deep breath in just to start me off, and then I'm going to exhale everything out. It's 96, 85 when you don't do anything? Yeah. No worries, Jeanette. I'll bump that back. I'll get you running marathons if that's what you want, okay? Well, did you guys know we have a marathon coming up? There's a marathon in May that the corporate office was asking me to join in, and they're going to put a camera on me. And basically how this would work is you would actually be walking in place in your home or riding a bicycle or doing leg flutters, kind of like simulating like you're pedaling a bike, right? And so when I join the race, it's kind of like you're joining the race. So as long as so the camera's going to be on me at the marathon. I believe it's in Indiana. So I believe, I'm not 100% sure, but I believe it's in Indiana. So instead of you traveling to the marathon, you would actually be just doing this at home. And if you do participate, you get a t-shirt. Okay, and there's little sponsors and stuff like that will help support us with that. But yeah, so if you ever wanted to do a marathon, see how far you can get. The marathon isn't 30 miles. This isn't like the Boston Marathon or something. This is like a simple, I believe it's a 5K, so it's 3.2 miles if I remember. So anyways, we're going to sit up straight and we're going to take a deep breath in. Then we're going to breathe out. So I'm going to keep breathing out until my lungs are empty. Exhale everything out again. Exhale again. By the way, when I exhale, I don't stop until there's no air left once there's no air left in my lungs and I don't feel any air coming out, that's when I won't inhale until the mouthpiece is in my mouth, and then I'll breathe in. So some people will do something like this. They'll breathe out. They'll accidentally breathe in, and they won't get so high because they haven't correctly measured. They accidentally filled their lungs up before the measurement. So you want to make sure you empty your lungs all the way out first, then fill your lungs up. Now, if you're not sure where to be at on this incentive spirometer, it's 65 milliliters per kilogram of ideal body weight. So, everyone have a pen and paper? So, all right, let's go over this real quick here. I have to use a calculator, of course. Okay, so 5 foot. So if you're 5 foot tall, if you're 5 feet tall, you know, your height. If you're 5 feet tall, that's 105 divided by 2.2 to put it in kilograms. That gives me 47.7 times 65 milliliters per kilogram of ideal body weight. And your maximum lung volume, if you're 5 feet tall, even, is about 3,102. So the highest you could ever reach, if you're 5 feet tall, is just above that 3,000, just above it, okay? If you're 5'1", it's just a little above that too. So let's say, so that's 110 divided by 2.2, that puts me at 50 times 65. That gives me 3,250, is about right there, okay? So if you're 5'2", write down 3,250 milliliters. Sometimes what some people have done, a lot of my patients have done, is they took a marker. Just grab a marker here. They grab a marker, okay? Permanent marker works better. This is a dry erase marker. But anyways, they'll mark it if their marker will work. Of course, my kids have to take my markers and dry them out. Then they put it on afterwards because I am not feeling this is working very much. Well, anyways, what they would do is just mark. This marker is not working, but they would mark where they should be at or closer to it. So you don't have to be at your max, by the way, but you want to get closer to it. Remember, you're a human being. If you're way under that, you must join into the program so I can at least increase the living daylights out of that and get your work of breathing as far down as I can, but to the point where you can walk pretty far. And, you know, I always set people up with at least a mile without stopping, you know, meaning if they can't walk, I can't even walk more than 10 feet. I'm going to show you how to breathe and walk. I'm going to do lung stretches, hyperinflation therapy, bronchial hygiene. I'll be doing every single nick and cranny to get results for you. And that's what I'm going to be doing for you. Okay. So you have to, like I said, you have to put a little trust in me on this. So anyways, if you're We'll go up to 6. Actually, I'm 6 feet tall, so I can use my numbers. That's 180 pounds, ideal body weight. I do not weigh 180 pounds, by the way. I'm 210. I like my pizzas and waffles. I'm not going to stop that. All right, so 180. I need to divide that by 2.2, and 180 divided by 2.2. That gives me 81.8. I should have remembered that. 82 times 65. That's 5,330. That means on this incentive barometer for my height, this piston should go all the way up here and probably stay up here for about maybe a couple seconds, you know, to hit my maximum lung volume, because it can't go up to 5,330 because the incentive barometer's max is only 4,000. So needless to say. Hey, I love pizzas and waffles. I'm Italian. I have no choice. But the waffles, I don't know. I like waffles. It's my thing. Bacon, waffles, steak, eggs. Woo! That's mother's milk to me, man. There is a saying, do as I say, but not what I do. Yeah, the same thing, Laura? Yeah. Oh, yeah. Oh, yeah. Oh, yeah. Could you imagine that, having a pizza with waffles on it? I don't think that would work, but I love pizzas and I love waffles. That's just me. Anyways, I'm sure there's a lot of people that like that stuff too. Okay, if our volume isn't as high as it should be, we need to do respiratory muscle training to pick up our lung functions, okay? This device here is specific. It's very specific on increasing lung volumes, lung functions. So when you're doing respiratory muscle training, especially with the Delta V, you will be increasing your lung functions whether you like it or not. It's just what's going to happen. But there is a way to doing it, of course. So if you're not sure what setting to be at, on the Delta V, there is all these numbers on this dial. You turn the dial, and of course, the lower the number, like 0 will have no resistance. Okay, if I increase the numbers, the higher the number, the higher the resistance. So the big triangle points at the number. What I tell everyone is to start at 5 first. Okay, just put it at 5. Okay, now you're going to place it in your mouth past your teeth, and when you inhale, you're going to roll your chest up a little bit. Okay, just follow me here. So I'm going to roll my chest up. I'm going to breathe in as deep as I can, and I'm going to try to fill my lungs even more than that. Even though I know there's probably not going to be any extra air coming into my lungs, the point is to keep the muscles responsible for breathing, the intercostals, the muscles in between the ribs, and the diaphragm, at a constant state of tension. Like it's constantly trying to pull air into your lungs. Those muscles will eventually, of course, get stronger. The website, I got you, Nadine. I'll fix that. I can ship one out to you, no problem. You know, I just have to ask the office. But yeah, no, not a problem at all. If you give me the contact information, I can have the office, like Jordan, I can have him contact you and just send one over to you. If you want one, Nadine, no problem. We usually give these to people when they come into the program itself. But anyways, so Delta V's, place in your mouth, breathe in. The count to fill your lungs up is 4 seconds. So you have 4 seconds only to fill your lungs up to your max. Okay, so watch me. I counted up to 6 seconds. And now why 6? Because I wanted to always improve. Okay, if I inhale to my deepest, which is, let's pretend it was 2,000 milliliters on my incentive barometer. So if I inhale to my deepest and I exhale from there, I inhale from there, I exhale, breathe in, breathe out, and I'm going to stay the same. I'm not going to improve my volumes. But if I inhale, maxing it out, and I'm not holding my breath, I'm still trying to pull air into my lungs, these muscles will obviously start getting stronger, And of course, I'm going to get a little sore. No, no, that's just what's going to happen. I'm going to get a little sore around my diaphragm and my midsection a little bit. But after about 2-3 days, you should start seeing a volume increase on your incentive spirometer where it's much more noticeable. Any suggestions for coughing with deep breaths through mouth? Yeah, I mean, there's a lot of coughing techniques I can go over. Kim, let's do it like this. Here's a good cough, okay? I'll show you a bad one and a good one, all right? So here's a bad cough. The volume isn't any good. So I'm not filling my lungs up deep enough to increase the pressure, to increase power behind that cough. So I must take a bigger, deeper breath, and I'll show you a good cough now. Deep breath, and then cough it. If I had anything in my lungs, it's out. A little congestion there, too. Drinking water will loosen up congestion. It creates the water itself. It's not supposed to go in your lungs, but what happens is when you drink the water, it will kind of circulate throughout your body and cause the globulate and mast cells in your lungs to produce more enzyme, thinning out the mucus, making it easier to cough out. If I do not have a strong cough, then I'm going to take one fist. I'm going to pummel my... No. I'm going to take one fist. I'm going to put it on my abdominals. Okay, not my chest, my abdominals. Take my other hand and press up as I cough. This will assist the pressure. This will cause the pressure, the power of the cough to be higher. So I put this, kind of like giving yourself a Heimlich maneuver. Put your fist on your diaphragm. It's called a splinting technique. You push up as you cough. It increases the pressure. Woo, that did a pretty good job, actually. Not bad. If I do not have that ability, then I'm going to put my elbows on my knees. Let me show you. I'm going to put my elbows on my knees, and then I'm going to do a huff cough. So to do a huff cough, okay? So what am I doing? I'm just breathing in and huff as hard as I can. I'm not coughing, I'm huffing. That's a huff. And you can tell I'm getting rid of things that I didn't realize was in my lungs. So I breathe in real deep. And leaning over is advantageous. So you want to lean over. Because if you're sitting up straight and you huff, all the congestion comes up, it just slides down because of gravity. If you lean over a little bit, you're adding surface area to your lungs, so the congestion will take longer to slide down, making it easier to pop out, to bring out. So you lean over, breathe in, huff. Now let's say the congestion went up halfway. Okay, if I breathe in too fast, I might lodge that congestion back in again. I don't want that to happen. So what I want to do is, on my huff cough, the second breath, which is the most critical, I must breathe in slower. So, first huff cough, second huff cough, slower. And then huff it. And then you should be able to bring that out. So, Tammy, if you feel like there's a lot of congestion but nothing is coming out, it's most likely, and I would say about 90% chance, most likely is inflammation, severe inflammation. And so you must attack that with the anti-inflammatory agents. So that's like albuterol, things like that help dilate the airways. See, what happens if your airways are not congested, but it's well inflamed, the globular mast cells, the epithelial tissues itself are so loose that it feels just like congestion. So I see this all the time where somebody's like, I'm coughing, I feel like there's a gallon in my lungs, but nothing is coming out besides a teaspoon, when it feels like there's a gallon in it, in my lungs. Usually that's always inflammation, and that is not congestion. It'll feel just like congestion though, but it's inflammation. Thank you, Sina. Yeah, there's nothing in your lungs coughing up, Tammy, because you are not congested. It's inflammation if you feel like there's a gallon in you. Okay, no worries at all. But you must attack it with anti-inflammatory agents. You know, if you eat an apple, yeah, nebulizers help out a lot. Those are kind of foolproof too, Michelle. Those are pretty good. But did you know if you eat an apple, especially with the peel, it has to have the peel on it. It'll reduce wheezing by 30%. That could be another way of obtaining like an albuterol treatment, but without the albuterol and without the side effects. It'll fill your stomach, it'll clean your teeth, but also it'll help. The ingredient, I believe it's in the what causes the dilation with the apple. I believe it's in the peel. It's called a flavicin. Yes, it's called a flavicin. Kind of like flavor. Yeah, it's flavicin. And that ingredient inside the peel of the apple is actually what triggers your lungs to dilate when it's inflamed. So when somebody's wheezing, they eat an apple before going outside. They'll find that their wheezing is not as bad because it's about a 30% reduction in wheezing, not 100%. And by the way, eating 3 apples to try to get to 100%, because 30, 30, 30 is 90, it won't happen. There is no medication that will give you 100% relief. It just, like prednisone will give you an 80% relief, but you'll have a mile long of side effects. Anyways, the Delta V should be done 6 times a day, 10 minutes each, until your lung volume performances have increased. Once they have increased, then you can just basically live your life the way you like to live it. Just check your volumes. If you do 3 different types of nebulizer medications, I'm assuming one's an albuterol, one's a backdoor inhaler like ipratropium bromide, and budesonide. Usually that's what I see all 3. I have a dilator, a controller that holds it open. That's the ipratropium bromide, 0.5 milligrams. And the corticosteroid, the budesonide, which is the corticosteroid, 0.5 milligrams, will help. Corticosteroids help with environmental exposures. You know, it helps reduce the onset of wheezing, exacerbations, and a lot of different types of things. But it works on inflammation the most. Okay, that's what it's for. All right. So if you're like on Symbicort, that's budesonide. If you're on Advair, that's a type of corticosteroid. It also has 2 medications in there, the corticosteroid and the alformoterol, which is long-acting albuterol treatment. But make sure that when you take any medications, even if it's just albuterol, you wash your mouth out, but specifically with the corticosteroid, rinse your mouth out, gargle to get the back of the throat, and then spit it out, or else you'll develop thrush, which no one likes. 3 coffee straws do work very well, Laura. You can use 3 coffee straws, and that will create enough resistance to increase muscle growth. Sodium chloride, yeah. So sodium chloride, simple salt, is basically helps thin out the mucus a little bit, but also mix it in with, your doctor should have told you, should mix it in with the albuterol. And the reason for that is the sodium chloride itself, it can actually cause wheezing by itself because it's an abnormal substance that's coming into your lungs, so your body will react to it. Altavera, yeah, very good, Tammy. Going on for Motorol, Alex? I got you. Okay. We can go over medications. I mean, I know all about the medications. We can go over medications, no problem. But why don't we get into some of the exercises today? Huh? So, yeah, we can, medications are great. I'm pro medication, don't get me wrong. But there is no medications that's going to fix this problem. That's why we take the medication all the time, but we don't really perform any better. Besides, the wheezing is reduced, things like that, but the overall performance of your body is not there because we have to do something different. Debbie, I used the breather a long time ago, but because I had no way of knowing if somebody was breathing in or out through it at a certain speed. Because there was no flow management system, we had to trash it, you know. And this Delta V, the very back end of the Delta V, can attach to the incentive spirometer to look at the flow meter on this incentive spirometer, this piece. Not this, but this piece right here. So let's say if, and you look at the top arrow of this incentive spirometer when you have a Delta V attached to it. So the top arrow, not the bottom arrow, but this top one. If this float goes higher at my strongest, my absolute strongest inhalation efforts, if this float goes above the top arrow, that means the setting, whatever I have it set to, is too light. If it's below the arrow, even just a little bit, it means it's too heavy. So, for instance, let me move this over, and I'm not going to tell you which number I put it at, what setting I put it at, but watch the flow meter, and you tell me if it's too heavy or too light. What do you think? Too heavy or too light? That was too heavy. It stayed up, but it was not on average, at the top arrow. It was just below that. And I try to inhale as fast and as hard as I can to see how my strength is. Okay, so now I'm going to reduce that down, and I'm going to try this. Let's see if this setting will work. What does that mean? It's too light. So now I know a 7 is too heavy, and a 4 is too light. I'm going to work this way up. I'm going to go up one extra number. I'm going to go up to a 5. Let's see if this works. How fast do I breathe in? As fast and as hard as I can. Though it gave me a good amount of resistance, 5 is still considered too light because because this float went and stayed to the top. So now let me move this up to a 6. 6 would be the most optimal one because 7 is too heavy. Yeah, it was just below that top arrow. So a 6 would be the most optimal one because it stayed on average around here, and that's where I want to be at. So once I have that flow setting, I have my proper setting. Very good, Dana. Then I'm going to take this out. Larry, it's okay if you don't get thrush. It's just a good thing to do is to rinse the mouth out. You know, it's just a good thing to do is to rinse the mouth out. But yeah, if you don't get thrush, don't worry about it. But I wouldn't wait until you get thrush to be like, all right, maybe next time I should rinse out, because thrush is no fun. I tell you that. You have to take nystatin, and it doesn't taste very good. I tell you, it looks like a strawberry flavor yoo-hoo or something, but it doesn't work very well. I mean, no, it works very well. I'm sorry. It doesn't taste very good, is what I mean by that. It doesn't work very well. Of course it worked very well. Let's see. I was on 2 different steroid inhalers and stopped because of terrible side effects. Yeah. Side effects is what's going to happen. If somebody was taking a medication and they didn't get any side effects, especially when it warrants the absolute side effects, then most likely that medication is a dud or it didn't meet deposition for it to work, meaning it didn't drive down deep enough. Nebulizers are kind of foolproof, meaning if you use a nebulizer, chances are it's going to get into the lungs real deep. If you use an actuator like a meter dose inhaler, then you have to be able to hold your breath for 10 seconds. You have to drive the medication deep into the lungs, meaning you need a certain volume on your incentive spirometer. And if you look on the FDA on any of the medications, they'll tell you exactly what volume you need. And this is all public information, by the way. Oh, absolutely, Tammy. Absolutely. Absolutely. You know, but remember, anything that you do, because unless you're one of my patients, anything you do, you always want to discuss with your doctor. Just call your doctor and say, hey, I'm going to mix my albuterol with the sodium chloride, okay, because of the wheezing aspect of the sodium chloride by itself. Your doctor should say, yeah, that's fine, you know. But always let your doctor know what you're doing. Okay, I got to keep things safe, people safe, and things legal. We got to keep things legal. We don't want to just stop taking medication or do something different without the approval of our healthcare provider. Okay, unless I am your healthcare provider, that's different. So respiratory muscle training is done 6 times a day, 10 minutes each. You never knew all this information? Oh, imagine this, Debbie. Imagine this. Imagine you. All right, for the past, I don't know how much time we've had. Ooh, we're kind of getting to a lot of time here. So for the past 51 minutes, for all the information you learned, imagine 3 months with me, specifically with me. Yeah. Now you know why people always look at me as the top one. Is they're like, oh, go with that guy, go with that guy. You know, it's like, yeah, I'm going to do my job. I don't quit. I don't stop. I use the spacer seams to really help get meds deeper. Yeah, that's good, Debbie. And Larry, very good. Yeah, spacers work very, very well. And I can show you different types of spacers if you ever want. Okay. All right, so respiratory muscle training, place it in your mouth. You breathe in real deep. It's fast. You got to do it fast. Try to fill your lungs up. Once you have your proper setting in place, you breathe in as fast and as deep as you can. Try to fill your lungs up in 4 seconds or less, but keep trying to inhale for an additional 3 extra seconds, okay? Because that will help keep the muscles at a constant state of tension where it's constantly trying to pull air into your lungs. Okay, that will increase volume. All right. So anyways, I breathe in. Maxed out. I'm going to keep going. Notice I pivot, okay? Don't let anybody tell you anything different. Pivot. How do we order the delta V? Let me do this here. Why don't you guys just join in? It'll just be covered. I mean, if you guys just join in, I'll give you a delta V. You want to do that? Is there a fly in here? Anyways, if you... trust me, I'm a good guy. It just should be a fly in here. Anyways, it's like he's squashing a fly, a little punk. It's like it's a fly. Anyways, if you join the program, I'll just give you a delta V. Why don't you just do that? Then you get into the program itself, and I work it out with you. Good job, Cena. Yeah, if you join into the program, just join with me. Okay? After this session, join in the Zoom and let me see where you're at. Let me see what happened. Let me see what you're doing. Okay? And don't worry. It's all HIPAA regulated. There's not going to be, I'm a clinician. I have to legally, I can't disclose any information from anybody to anybody without your permission. Okay? So everything's going to stay confidential, you know, but when you come into Zoom, I don't want to know any personal information besides just letting me, I just want to see what you're doing. Okay? So that's what I want. I want to see that. I want to see what you're doing. Okay? We only have a little bit of time left. 6 minutes left. Do you think we have time for our exercises? Because I wanted to do some exercises. I love doing the exercises. I love doing it with my classes. Join into the program. Let me work with you, okay? If there's a shot of improving you, everyone knows I'm the best shot there is to date. I won't waste your time. I'm not going to give you any false hope. Just put a little trust in me and just let me show you what I can do, okay? Because doing everything through Facebook or YouTube, it will get you so far, but I really want to do some real... Yes, Medicare covers it. Yeah, I just said Medicare it covers this program. They opened it back up, but it's only going to last till January, the end of January. So, but if you come in early enough, you'll be what they call grandfathered in, so that you'll still be allowed to still continue with me. Okay? All right. Larry, what's with the dead guy? The program length is, well, that's a tough one. Some people are very sick. Some people are not as sick as others. So it really depends on the person. But inside this program, we have people that stay in for years because once they get into the program and they finish it out and they get their life back, they just maintain it and they will come in once a week just to make sure they're still at that level. And they'll see me, I see them, of course, and we would just work out together just to make sure they're maintaining. I'd check volumes, see if there's any problems, any complications, if they're getting sick, if they have, maybe pleuritis, if they have any types of any complications, really. But the program usually is only about 3 months. But there are people that are very sick and they need a little bit more time. Like I get people that can't walk, they're bedridden, and I'll exercise with them. I'll do respiratory muscle training with them. I'll still get them off oxygen, but I'll get them to walk. And that does happen often here. As long as they have legs and they can move their legs, chances are I'm going to find out how to do it. I'll talk to your doctor, see what I can do. Medicaid. Well, Tammy, so with Medicaid, we do have abilities. We have a lot. See, this program is the very least expensive program in North America, but it is the most successful program in North America. And it is. Harvard and chest physicians over in Honolulu, they did a study on us, and they saw that we were the top ones. We are the top ones. And the only reason why we're the top ones is because we implement the breathing exercises the most. We are specific on the breathing, very specific. Because I'm a respiratory therapist, that's what I do for a living, But we're very breathing. I'll show you how to breathe and walk, breathe and climb stairs, breathe and bike, breathe and run, jog, whatever you want to do, But with Medicaid, Tammy, the best thing I can say with this is that we will fight on the Medicaid. You still join into the program, and we'll work something out. Don't you worry about it. You're not going to wind up with something crazy or something like that. That's not what we do. We're clinicians, but of course we do have to get paid for the efforts and everything that we do because we have to eat too. But yeah. After this, okay, like I said, I'll keep Zoom open till 3 p.m. Eastern Standard Time. Till 3 p.m. Come into Zoom, okay? Breathing techniques are not necessarily a secret. I've been doing this for over 25 years now. I can't believe I'm close to 50, but I am. You can tell with the bald head a little bit, or not enough hair on my head. When I wear a hat, everyone thinks I'm 20, but as soon as I take the hat off, they're like, oh yeah, he's at that age, But anyways, come into Zoom. Let me see what you're doing. Okay, I just want to check to see what's going on and what we can do. And if you have questions or anything, I'll be happy to answer anything. Okay, and we'll do that. All right, but next week. Today's Thursday, so next week on Tuesday, I would like to do cardiovascular. Would that be okay with everybody? Would that be okay? Cardiovascular exercises. So write this number down, 220, and subtract your age. Subtract your age. So if you just use a calculator if you want to. You can do it in your head if you want to, but anyways. So you just take the number 220, subtract your age, like I'll subtract my age. I'm 47 years old, and that gives me 173. So that's my maximum heart rate. You must know your maximum heart rate and your minimum heart rate in order to exercise cardiovascular so you know you're doing it correctly. So that's my maximum heart rate. Obviously, I don't want to get to that max. What I want to do is I'm going to multiply by 0.7. And that's going to give me 121. That means if I'm riding my bike or a treadmill or any of my machines, I want to keep my heart rate closer to 121 beats per minute when I exercise. This will ensure that I'm doing proper. Alex, I'll go through it again to get into Zoom. You just go to our website. I'll show you. Our website is homerehabnetwork.com. Okay? But I'll show you. But when I exercise, I got to keep it at 121 beats per minute. This will ensure that I'm doing proper cardiovascular exercises that will benefit my heart, my lungs, my body, everything. Exercises can cure pretty much anything if you do it right. Depression. Oh yeah, exercise can work on depression. Anxiety can work on a heck of a lot more than you think. All right, let me show you how to get into the Zoom. Okay, you ready? Okay, so you go to our website. So let me, 1 second here. So to get to this website, you just go to homerehabnetwork.com. Okay, once you're here at the front website at homerehabnetwork.com, press the enter button, which is right there below this logo. You see it says enter appointment. Click on that. It takes you to this screen here. Scroll down, meaning go down the page. Don't worry about all this. Just go down the page where you see me. Underneath my picture, click on enter appointment, and that will open up Zoom for you. If you don't have it downloaded, it'll download it for you. But that's all you're doing. You're just clicking underneath my picture where it says enter appointment. Okay? Because if I clicked on this right now, Zoom would open up in my on my computer. So I can't do that because it will end the session here. Okay, so that's how you do that. Does everyone understand? HomeRehabNetwork.com, enter appointment, scroll down till you see me. Okay, or it looks a lot better than this, I think. Scroll down where you see me and just click on that and it'll open up Zoom for you. If you do not have Zoom downloaded, it will download it for you and put you directly in the class, okay? Cena, I understand. I wish, we'll do what we can for you. No worries at all, okay? Don't you worry. We'll work something out, okay? It's just a couple pennies or something. It just doesn't, we got to pay doctors, we got to pay respiratory therapists, and I hate to say that, but the program in itself at $39 is $1.33 a day. That's the best we could ever have done. A traditional facility is around $24,000. Going to outpatient is $50 per visit. And we're the least expensive. But yes, it's all free today. I just want you to join me so I can see what's going on and what's happening. Yes, it's free today. Okay? It's free today, yes. I'm not here to charge you. I just wanted to know what you're doing, what's going on, what's happening. Okay? So I can, because without me visually seeing you, I'm not sure if you're doing it right. Anything like that. Yeah, it's $39 per month to see me once a day, yes. And it's one time a week. If you go to a higher tier, it's a higher tier. Meaning if you go to a 2-tier one, it's you see me 2 times a week. If you go to the highest tier, it's 3 times a week. You'll see me. And seeing me, it's not just seeing me, hey, how's it going? How you doing? I'm not like that. We work out together. We work out. We do respiratory muscle. I do everything until your doctor and you are happy with your performance. Okay, no problem. No problem. And we do have staff that can help walk you through Zoom if you ever need that help. Okay, but if you can't get into Zoom, at least do me a favor, go to our website. Let me show you again here. If you can't get into Zoom, go to our website again. Instead of entering appointment, just scroll down the page all the way down near the bottom where you see your request information. Okay, put in your name, your email, and so I have a way to contact you, your phone number, reason for contact, and of course, if you have or not have a health insurance, that's just what Dr. Shaw wants us to ask. But just press that submit button. This submit button, press that submit button after you're done. That'll get sent over to me directly, and I will help you and call you up if you're having a hard time getting onto Zoom. Okay? Everybody, thank you very much. And let me get into this here. Thank you very much. I'll see you in Zoom, okay? Which is best for me to do? How many times a week? Well, that's what I want to discuss. I want to see what problems you have and stuff like that. I want to see what's going on. See how far can you walk and things. And I'd like to talk to you if that's okay. So but we'll work that out. I'm only, it's not a Zoom link. Remember, Joy, everybody, to get into our Zoom class, okay? Maybe we should be calling it Zoom class. But to get into the Zoom, you just go to our website, click on, which is homerehabnetwork.com, click on enter appointment. I'll show you again. So to get to this website, you just type in homerehabnetwork.com. Okay? To get to this website, homerehabnetwork.com. Right here where it says enter appointment. Okay? Just under this logo, click on enter appointment. Takes you to this screen here. Scroll down until you see my face, which is right here. Underneath my face is this button that says enter appointment. Just click on that enter appointment button. Click on that, and then that's the link that will open it up for you. Okay? All right, everybody. Sorry we didn't get to do a lot of the exercises today. I wanted to do some exercises. I always like to do exercises with everybody. But anyways, we kind of got tied up a little bit, I guess, with a lot of conversation, which is great. There's nothing wrong with that. Yeah, no worries, Cena. No worries at all. If there's a shot of look, everybody, just understand. If there's a legitimate shot of actually improving your lung functions, actually getting you to walk further, without a doubt, I am the best at that. I'm specific at that. I'm specific on the breathing, specific on all that. Yeah, that's why everyone always likes me, you know. But also, I'm kind of funny sometimes. Sometimes, you know. But I'll see you, okay? All right. So I'm going to open up Zoom, all right? And if you're going to come in, I'll see you. I'm going to close it at 3 o'clock. 3 o'clock, it's going to close. 3 o'clock, it's going to close. So that's Eastern Standard Time because we're in Maryland, or I'm in Maryland, okay? All right, everybody. Thank you very much. I'll see you in Zoom if you're going to come in, okay? And no worries, I'm not going to do anything else besides just see what your performance, what the problem